Welcome to the Alcidion Insights Series. In-depth interviews examining workflow challenges and opportunities for digital innovation on the front line of healthcare. Join us to learn how Miya Precision can support your team. Healthcare workers are drowning in administrative tasks. How serious is this problem?
There's a recent poll that clinicians dedicate nearly 28 hours a week to administrative tasks and documentation. That's a huge burden on their time. Imagine if we can use AI technology to transform that and give them that time back to care.
We face a significant challenge in the administrative burden that's driven into our workforce, whether that's in an administrative role or clinical. And this is really real, like the amount of work that we're asking people to do and engage in. Almost every geographical region that I visit has the same issue relating to workforce, that there are gaps in the workforce, it's difficult to recruit, it's difficult to retain people.
When we talk about AI in healthcare, what kind of AI are we actually talking about, and what should it be doing?
There are lots of different perspectives on AI and how that gets used in a healthcare setting. I have a perspective that whilst there are some ambitious elements to artificial intelligence that will absolutely revolutionise how people interact with digital systems, I think there's a real need to understand what are the problems that people face day to day and how can we use artificial intelligence to solve those problems. So it's much more of a ground up approach to how we develop the use cases and deploy AI into a health setting.
We can use this technology to surface key information, analyse large data sets, and make suggestions to augment clinical decision making. Equally, we can use this technology in our own business to accelerate the development of our platform.
Where do you expect AI to make a tangible difference to clinician workload?
There are two areas for me. The first is the impact we can have on reducing administrative burden. The second is that surfacing of information to support clinicians in making faster and better decisions in their patient care.
When it comes to Miya AI functionality, what is your favourite new capability that the team is working on?
At Alcidion, we've worked really hard with our user base to understand what are the things that create day-to-day frustration when you're trying to do something. And one of the capabilities that we're looking at is around handover and ambient voice handover capabilities. So the amount of work that goes into creating handover often is up to an hour, like sometimes even more in different settings. And then people capture notes or take recordings of that in terms of activity. And what we've worked on is using summarization, to understand what's the reality of that person's care over the last 24, 72 hours, whatever time frame we configure, but also using ambient voice to capture the discussion and also create the sort of tasks and activities. And what that means is that people are free to engage in discussion, to pass over context and those critical bits that aren't necessarily data points, but might just be part of somebody's experience of they didn't look so well today, they've been mobilising less, and their family haven't visited for the last couple of days. And these sorts of bits of information that's so important to capture.
One of the areas that we're working on at the moment is resolution of outliers. So outliers is the definition of that. I'm potentially a patient that has been admitted, I'm post-surgery and I've been put on a medical ward because there are no surgical beds available. So they've got to put me somewhere, I'm on a medical ward. Now, that care team, of course, are going to give me the best care possible, but they're not experts in the care that I need. It also means that the general surgical team have to make a diversion on their rounds to come to see me on that general medical ward. One of our clients calls that safari rounds for the care teams because they've got to walk further around the hospital to achieve what they need to do. We have all the information available to now using AI and predicting an outcome based on analysis of the data that we've got to say, if you make these 2 moves, 3 moves or whatever, you'll resolve 3 outlier patients.
If we get this right, what does a clinician's day look like in 5 years' time?
There are three seismic shifts that we're going to see in the next 5 years. The first is around the move from documentation to ambient intelligence, and that's where we're using these technology capabilities to capture the information for clinicians rather than them having to write physical documentation. The second we're going to see is moving from predictive capability to prescriptive capability, where we're using this technology to augment and support clinicians in their decision making, to provide a digital safety net that supports them in their work. And the third shift we're going to see is that move from hospital-centric care into ubiquitous care, providing that care wherever the patient is.